Okay, yeah, and we went into.
That's what I did last time. I'm sorry, Mark. That was
That's
my
okay.
bad.
That's okay.
Oh,
We just can't say anything bad about Danny Gilbert while we're on here, or anybody else. Hi, everybody. This is Mark. We will get started in about 5 minutes.
does that show on my screen though? But that's what I messed up. I knew I messed up last time. Is it
Yeah,
showing my? Okay.
it is showing your screen. It is showing your screen. So.
Now,
Okay.
now you change it back to you. Okay, I got it. But I know my error. I just got to remember. I'm so good on Zoom. I'm just not good on.
Okay. Oh no, go to webinar. Yeah, yeah. We've had go to webinar forever. So that's our thing. Okay, now I got to get mine working right. Let's see, make another. I'm the presenter. Okay, shows my screen. Let me turn this off. Okay, there we go. There we go. Now I think we're back ready. Okay, good. Okay, there we go. All right, we'll make sure we're going to get started in about 5 minutes. Everybody that's here early, there are a couple of handouts over in the side here if you want to try to pull them, download them. Also have it on the Facebook group, the Rural Health Clinics Information Exchange, and it is on our website at ruralhealthclinic.com. And then I think it's the /COVID-19. The slides are on there as well. That's where we will have a recording of the session as well. It'll be on YouTube. And let me double check and make sure that we're, let's see here, and we are recording as we speak. Hello, everybody. I'd like to welcome you to today's webinar. This is the So I Got My RHC Vax Confidence Grant, Now What? And I've been getting that question a lot. And Elizabeth Burrows, lawyer who is here with us, she's also been getting that question a lot. And she's the one who actually knows the answers to that. So, hi, everybody. I am Mark Lynn. I'm the guy that doesn't know the answers to these questions. And we've got together this little webinar to get Elizabeth back with us one more time and tell us what we need to do since she was so great and actually got so many of you guys this grant because we've never really gone through this process before. So before we turn it over to Elizabeth, we'll just go through real quickly and just tell you, if you don't know who we are, there is my picture. I think probably looking through the listing over here of attendees, I think I know pretty much 90% of you guys is over there. So that's my information. That's my CV. Danny Gilbert, who's a CPA that works with us, and both Danny and I have been killing it on these cost reports here. I think we finally got them all done, except for a few of you scragglers who didn't get your information in until a day or two ago. Those are done, and we're moving on to doing provider relief funds in the next 45 days or so. That they're due by 9/30. So that'll be our next project that Danny and I will have. Mainly work with all we work is with RHCs, doing pretty much everything related to RHCs except doing grants, and there's a few things we don't do credentialing and billing and some things like that. If you have not joined our RHC information group, we're right at 2,700 members so far, and it's a great resource for you guys. It's a great resource for me. I learn a lot on there every day as well. If you can also go to our website at ruralhealthclinic.com, there's resource sections there. So on the resources there, you can see emergency preparedness has a ton of materials, certification materials. If you want to become an RHC and not use us or somebody else, you can. There's pretty much everything you need on there. Billing, cost reporting, program evaluations, COVID-19 information. There is a ton of resources out there. Here's just one of the sections here on billing, and we are planning on getting that up to date. I know our billing is a little bit behind just because COVID hit, and we normally update that every year. Here is our COVID-19 page. This is where your presentation will be. I did download those. I think some of the people said it worked about half the time, so which is the normal for GoToWebinar. Usually when I download a slide over there, it works about half the time. So I did put it on this COVID-19 website if you want to get your presentation that Elizabeth has put together. And then this is the first of two. So Elizabeth will be back with us on Thursday at the same time, same channel, and then she'll be going over today. She'll just talk about, I guess, the basics of what the grant was all about. And then Thursday will be the important one because she tells you how you can get paid through the payment system. So those are the two webinars that Elizabeth will be on. Next week, I will be going through, between now and then, I will be going through the provider relief portal and getting several of our clients in, and I'll give you some secrets and some how we got that done next week on how to get the provider relief reporting done. So I'm sorry about a week behind. I got a little bit of a cold from my trip from Maine, and thought I might have had COVID, so I've sort of been hanging out for the last week or so doing nothing. So questions, if on the sidebar here, if you just ask your questions, we will open it up at the end for Elizabeth for you guys to ask some questions, and Danny and I will read those questions to her, and she'll give us some answers to that. Information is current as of today. We're not providing any legal advice or any type of consulting, so do consult with your person, because this is not going to be considered any type of legal advice to you guys. And here is Elizabeth. She's fantastic. I've known Elizabeth for many years now. And anytime there's anything related to grants or FQHCs, which I don't do, we send them to Elizabeth, and everybody has come back extremely, extremely happy. So that is a good thing. So what I'm going to do now is I'm going to turn this over to Elizabeth. And let's see here. Elizabeth, I'm going to make you the presenter, and hopefully this will work, and see if you get control of it. I know last time we did this, there we go. It looks like it's working. Yay.
All right.
Okay.
Let me see. There we go. Okay, well, thank you all for joining. I know I've been getting a lot of questions about this grant, so we're all excited with our 49,000 and some change per RHC. And now what happens? I am going to start with a quick disclaimer, which is that if you have not received your grant, that is probably an issue with your SAM. I have about a few people that I've been working with that we have discovered that. You may think that your SAM is okay. You may think you're set up okay. You may think your boss registered it properly. Check on that. Some of you may be getting emails back from NoSOR explaining the issue. If you haven't, make sure you look at the contact emails at the end and reach out. Reach out to me, reach out to NoSOR, reach out to the National Association of Rural Health Clinics or someone, because it is probably a setup issue with the SAM system, especially for those of you that received your SAM registration late, like at the last minute. We were all rushing around to get everything submitted. There are issues with that, and some things did not flow over from the back end on the computer system as they were supposed to. So if you have not received your notice of award, make sure to reach out to one of those. But I think most of you have received your notice of award, and now we're to the main presentation. Now, what do we do with it, and how do we go? I will say, please join us on Thursday, and there will be additional information as well. Today, we're going to go over your notice of award. And I'm just going to say that is your most important document. That is your Bible of this grant. That notice of award must be followed. Those are your rules, your regulations, your policy, and your procedure manual. So make sure if you can pull that out or pull it up on your screen as you're listening to me, that would be great. What are your obligations of your organization? So as a grantee, what is it that you now have to do? So I'm going to take this money from the government. What is expected of me? How do I spend my money? That's my most popular question I'm hearing. And then who do I contact with questions or concerns? So please hang with me, and I'm going to go through each of these points. So your notice of award, and it should look something like this. You should have gotten it. It was a PDF. It should be about 5 pages. Make sure you have that available to you, that you've saved that. That is very important. That is not just a congratulations letter. I'm going to throw it in the trash and I'll file that away on my computer. I don't ever need it. No, that is something that is an active document, and you need to make sure that you're following the regulations of that. Please take note of your unique federal award identification number, which is now called the FAIN. That is eventually going to replace your DUNS and be your most important number. So just know that number. Eventually SAM and DUNS are going to the FAIN, but make note of that. That is something you will need in the future and you will probably need for your reporting. See the amount of your award. Absolutely no one got the amount they applied for. So really everyone got slightly less than what they applied for, which HRSA was happy about, which meant more rural health clinics took advantage of this exciting opportunity. As a big proponent of RHCs and FQHCs, I was so excited to see that you guys actually got a little less than you requested. Of course, the people I wrote the grant for, I wish they would have gotten more and been able to take advantage of that. But I'm excited because that meant more than HRSA expected of you RHCs took advantage. That tells them there is a need and they should use you guys later. Claim spending costs within the award dates of July 1st to June 30th of 2022. I'm going to talk a little bit more about that later when we talk about how to spend the money. I'm sure one of you is already putting in the chat, oh, but Elizabeth, we could spend starting in March or April. I remember I read that somewhere. This is what I'm telling you, to keep things simple and to keep yourself as less stressed as possible, least amount of stress level, which we all need right now. Just claim your spending for costs within the award dates. It will save you headaches later. Also, make sure all the information about your organization is correct. And I do mean all the information is correct. I will tell you, one time I got a notice of award. The address was off by one number. So instead of it saying 514, it said 513 as part of my address. There was no 513, so I thought, oh, well, that's not a problem. It's just a little typo, no big deal. It's a big deal. I was not able to draw down funds from that grant for about 6 months because I had to get that error corrected. So if something is wrong, and I mean anything is wrong, it's the wrong, instead of saying Elizabeth Morgan Burrows or M Burrows, it says Elizabeth O Burrows. That's a problem as a project director. Get that corrected. If it says your address is off or the zip code is off by one number, get it corrected. So look at every little number, every little address on your notice of award, because I'm telling you, you have to make sure everything is correct. If there is something wrong, please identify that as soon as possible today, because you're going to review it as we're talking or right after this call. Let somebody else review it. It's just like doing your grant review. Then you need to contact your grants management specialist and or your program official to get any changes made. Both of them are in number 9 and 10 on your notice of award, boxes 9 and 10. But if something is wrong, and again, I don't care if they spelled something wrong. I don't know if normally they spell Stephen S-T-E-V-E-N and instead they put a S-T-E-P-H-E-N and you say, no big deal, everybody spells my name wrong. If you're the project director, it needs to be spelled right, so get it changed. They can change it back in the HRSA system and they will reissue you a new notice of award. Trust me, you will want to make sure everything on that is right. I know you're saying, Elizabeth, we get it. You know, quit telling us the same thing. I'm just telling you, I would venture to say at least 10% of you have some error on there. Minor error, little typo, the system flowed over weird, something else happened. Make sure you get those fixed. Read your specific notice of award. So every notice of award is slightly different. I thought about putting up a notice of award as part of this presentation going through it. The reason I didn't is because the examples HRSA gives are more thorough and look different than what yours look like. And also every rural health clinic award is slightly different. Some of you may have to make a change to your budget, to the project narrative, to the work plan, or to the verification of eligibility status. If you are being requested to do that. Make that change immediately. If so, it will be on your condition. So it will be toward probably about page 3 or 4 telling you to do that. So you need to read your specific NOA to make sure that you do the items that are required of you. And everyone's NOA may be slightly different. Don't go and talk to all your friends at the Rural Health Clinic conference and say, well, mine didn't say to do that, so I bet you don't have to do that. These are individualized. Make sure you read your specific notice of award. And that means read every element. Don't just read number 1 on each section and say, I'm good. Actually read this word for word. I love to speed read. I love to skim read too, just like the rest of you. But this is something that you really do need to look through word for word. Please know that any significant changes in scope or budget revisions must be submitted through prior approval section in the HRSA electronic handbook. Every NOA I have seen says that same thing. You will need to contact your HRSA program official prior to doing that. So eventually you will have to register with the HRSA electronic handbook. You can go ahead and Google that and do that now. But any changes that you're going to make, if they're significant, meaning over 25% of the cost that you're going to spend, then you need to get prior approval. We'll talk a little bit more about budgets and how to handle that a little later on in this presentation. My associate Kara Gamble and I will be walking you through the payment management system on Thursday as best we can. It is a little bit of a difficult and challenging system to navigate, but again, everybody's figured it out. And always know, just as the SAM and the grants.gov helpline were often helpful and great, I heard about 95% success with both of them. The payment management system is the same way. Now we're going to talk about your obligations of your organization as a grantee. So first of all, you have to use the funds for allowable expenditures. You can't just go spend the money however you want. And we're going to talk about allowable expenditures next. So that if first your NOA says you have to use the funds for allowable expenditures. And it does go through and list things that are not allowable expenditures. Things that are not allowable: vaccine storage and handling, vaccine inventory management, vaccine preparation, refrigerators, freezers, temperature monitoring devices, facility and land purchases, etc. Those are listed on your NOA. Those are not allowable. HRSA does do a better job of explaining what's not allowable than what is allowable. And so that's where I'm going to try to lend some advice next. Your next obligation is you have to register with the payment management system. The link is on your NOA and you can get started on that right now. You also need to register with the HRSA electronic handbook for reporting and changes. It's unclear exactly what all reporting will be required other than your FFR through the payment management system, but it's still a good idea to get set up in HRSA EHB, which is the electronic handbook, as that may help you with grants in the future. As an obligation of your organization, you also have to follow the terms of the NOA. You also, and I'm going to say this a couple of times, need to respond to HRSA requests. Many of you did when they asked you for your financials, and many of you had to submit your most recent financial statement. And you did that in order to get the grant. Make sure you have a quick turnaround time. I know some of you said, oh, I got the email on Friday. But I didn't see it till Friday because I was on vacation. It's due on Monday. I don't know how you handle things, but you need somebody. If you go on vacation to Maine like Mark, you need to make sure someone is checking your email if you're not going to be able to check in on that yourself. If you are sick, make sure someone else can check your email. So, I always say plan to be hit by a truck. That's what I always did when I ran my RHCs and FQHCs, and that literally happened to me. I was hit by a truck. And thank God someone else in my organization knew how to continue to file reports, check emails, and make sure that we were compliant with HRSA, because I was out of commission for a couple of weeks. You also need to have necessary policies, procedures, and financial controls. And that I use the direct quote from the NOA: policies, procedures, and financial controls. So you need a grants management policy. You don't have to have everything really thorough because you're only getting less than $50,000 in federal grants. If you are a system that's getting a large amount of money, meaning over the $750,000 threshold in grants, or you have other grants that would total that, you will have to go through an A133 audit, and you should have a policy that states that for your organization. If you are a public entity, meaning you are a town, a city, or somehow you're declared a public entity for whatever reason, such as hospital districts in some states, then you may not have to go through that audit. You do need to make sure you have financial controls as far as who's drawing down the funds. Don't make them complicated. If you need help, reach out to your CPA or to me, and I'm sure Mark and Danny could help you as well. There also are samples that HRSA provides a link to on your NOA, and you can also look up sample HRSA grant policies, and they will come up through HRSA's website. Now you're saying, okay, Elizabeth, you just told me all the boring stuff. I don't really care. I just want my money, and how do I spend it? So here's what I'm going to say. Do not do the following. What I don't need you to do is start putting in the chat, wait, I found where you can do this. I'm giving you this advice, not as a HRSA employee, and I know on the HRSA call last week, they kind of tiptoed around some of these issues. I'm trying to tell you how to make it as easy on you in the future, so that way you're not calling Mark and myself next July when we're trying to take vacations and saying, how do I do this report? How do I do this SF 428? How do I do that 428C? Elizabeth, how do I do this equipment report? And I don't even know. Now HRSA owns my equipment. I'm trying to save you headaches. So what I'm going to try to tell you is the easiest way to spend your money with doing the least amount of reporting. I think that's what most of us want to do. So no indirect funds unless you have a federally approved indirect rate. If your organization has a federally approved indirect rate, most universities do, a lot of cities and towns do, that's fine, you can do that. Otherwise, you should not have indirect funds. All the NOAs put your money in other, which really means you can kind of do with it what you want. They didn't want to say that on the HRSA call, but if you read between the lines, that's kind of really what they are saying. So these are your rules. Don't spend on indirect funds if you don't have a rate. Make sure you do not pay more than an employee's salary. So in other words, if you can't pay more than their full salary out of this grant, you also, if you're paying half of it out of this grant and half out of another grant, that's okay. But you can't pay half out of this grant, half out of another grant, and 10% out of another grant. That's over their salary. And if you purchase equipment, which is items over $5,000 or more per unit acquisition cost, you must do extra reporting. And in reality, as Ms. Gaines said on the HRSA call, this item will be owned by HRSA. So my advice, don't buy something more, the per unit acquisition cost is more than $5,000. Don't use it on an indirect, and don't overpay somebody out of grant money. So those are really, really your rules. How can I spend the money? Pay staff members and fringe benefits. If you worked with me on this grant, that's what I told you to spend it on. I know it went into other, but again, pay your staff and fringe benefits. Staff members are fine, as they said, people helping schedule shots, people encouraging people to do shots, any kind of education, any kind of enhancing access to care. Any of that is fine. Purchase supplies. Supplies are anything less than $5,000. Purchase any kind of supplies you want. I wouldn't purchase vaccine supplies. I would purchase office supplies. I would purchase outreach supplies, education supplies, any kind of supplies that aren't covered with other programs. Also, vaccine confidence events. A lot of you are doing back to school events to increase vaccine confidence, doing social media campaigns, billboards, buttons, t-shirts, anything to improve vaccine confidence in your rural area. Yes, you can do events. Yes, you can do billboards. And guess what? Promote yourself. You know, don't just say get the COVID vaccine. No, say get the COVID vaccine at my rural health clinic located at this. These are our hours. You know, this is your time to really promote yourself. Self-promotion is effective. Bring people in your clinic. And then the next on the rest of the list in the next slide are straight from HRSA.gov. So these are what HRSA says you can spend your money on. And consider how vague these things are. 1, helping to increase vaccine confidence and uptake. Those are any of the things we just talked about, and I'm sure you could come up with 5,000 more things that you could do. Improving healthcare in rural areas. That's where your staff time definitely counts. Are you improving healthcare in rural areas? I believe everyone on this call and anyone listening to this later definitely is doing that. Reinforcing basic messages about prevention and treatment of COVID-19 and other infectious diseases. So are you doing any classes on hand washing, any kind of prevention or treatment, any education? I'm sure you're doing this constantly with your patients. If you joined early, you might have heard Mark and I even talking about this very thing, just things that are happening that different places where we're at are doing, ways to prevent COVID. This is everywhere, flyers, papers, any of that can and should be paid through this grant. Accessing vaccinations, education and outreach efforts for vaccine benefits and safety. Again, super vague. Vaccine promotion, providing info to rural residents on how and where to get vaccinated. This again, promote yourself and your clinics, and coordinating with existing vaccination sites and public health partners. So again, really, it is extremely vague how you can spend your money. You're all increasing access to care in rural communities, and you're all promoting vaccines in some way. This does not say you have to provide the vaccine. Also keep in mind, this is not paying for people to do the vaccine. This is solely promotion and giving good messaging to our rural communities. Today I saw a headline, rural communities can't fight the Delta variant or can't avoid the Delta variant. So this is our time. We really need to step up, whether you agree with the news or not, and really promote our rural communities getting vaccinated to help them in any way. And then just some extra tips from an experienced grantee. I've dealt with a lot of HRSA grants and other grants, federal, foundation, state. Here's just some tips that I've learned along the way that I want to share with you so you don't make any of the mistakes that I did or that people I've worked with have. Do not request an extension. HRSA wants you to spend that money. As rural health clinics, we need to show that we're going to spend that money. We need that money. So, you know, the goal is have it spent by June 30th. Heck, have it spent before, because that shows that rural health clinics are doing what they need to do, and maybe we need more money in the future. I know it says you can request an extension. If you read between the lines on the HRSA website, they don't want you to do an extension. It's a lot of paperwork, and you just don't want the headache. Spend your money during the project period. It makes it easier to track. It's going to be less questions later, and it's not going to confuse your auditors. Once you go through your audit, if they see you're claiming grant costs from May and the grant started in July, it's going to be a lot of documentation and paperwork. It's easier just to spend it during the project period. Personnel costs, fringe benefits, and supplies are the easiest method of spending with the grant. You already are keeping track of your staff time somehow through some method for your payroll. It's already done. And supplies, when you purchase, you should have some sort of receipt. We'll talk about this more on Thursday, but you don't really have to upload receipts. It's just something to keep in case you get audited. My personal advice, and this just comes from me personally, Elizabeth Burrows with experience with grants, don't use this for rewards or incentives, because the rules are extremely complicated. Yes, I am a lawyer. Yes, I have read all the OIG rules. Yes, I do know that you can do rewards or incentives, but please know it's complicated. The rules are not clear. They're still working it out. And hey, pay your staff. And then if you want to put people in a drawing for you know, baseball tickets or football tickets or whatever to try to increase your vaccination rates, great. The money you saved on helping to pay your staff to do vaccine education, you can then buy that reward or incentive. And don't purchase a mobile unit unless you will only use it for the vaccine confidence program. You're going to have to track time. You're not going to be able to use it for other reasons, and it's going to be extremely complicated to track. Plus, keep in mind, really at the end of the grant, HRSA owns it anyway. So if you worked with me, I would definitely say, please don't purchase a mobile unit with this grant. Contacts. For questions about attaining your NOA, so somehow you didn't get your notice of award, you haven't got your proper documentation somehow, you need to get your grant contacts or any other kind of basic grant questions, here's the 3 people I would go to, probably in this order. RHCVAX confidence info at nosor.org. Lynette Dixon is doing an amazing job on getting right back to people and providing answers. RHCVAX confidence at HRSA.org and VAX confidence at NARC.org. And again, they all are doing great. HRSA's responding. Nathan Ball is right on responding. So, you know, really work with that. I just say to use NOSOR because that is who HRSA contracted with for those questions. So I would go to them first. If you don't get the answer that you need or you need additional information, then I would go to the other two. On your NOA in box number 9 is your grants management specialist. Ask them any money questions. But again, they really don't want to know unless it's a significant change. They've put it in others so you can spend it how you want. And trust me, they don't want to know if you should order orange paper or pink paper for your flyers. They also don't really care whether you're paying the medical assistant or the nurse. They just need to see the personnel. They just want big picture. And on NOA box number 10 is your program official with programmatic questions. And you should have a call with this individual. They should reach out. If not, feel free to reach out. And again, I can't underscore this enough. Respond to any and all emails from either of these HRSA officials or any other HRSA websites. If you have questions, you can always reach out and email me to see if it's legit or not. I know many of you are getting requests saying your SAM is out of date and telling you to pay $700 or something to update that. You should not have to do that. If they're asking you for money, that's a problem. If it's a legitimate HRSA email, you should be fine. It should say at HRSA.gov, or you can send it to me and I'll be glad to look at it and tell you if I think it's legit. Thursday's presentation, we're going to go over the payment management system. How do I get my money and funding? What documentation do I need? And what are the reporting requirements on this grant? So that's going to be Thursdays. And again, I'll be joined by Kara Gamble, who knows and has worked with the payment management system more than me to be able to answer your questions about that. Now, you can contact me for a free resource about the payment management system. We have a free one-pager to help you gather through that. So email me below if you want that or if you need future grant information. I'm going to answer a question before many of you can ask it. And that is, has the USDA money came out? Our facility grants, that was supposed to be announced actually by August 8th, which was 2 days ago. And it isn't. My contact at USDA says it should come out any moment, and they are all watching the Federal Register as well. So if you want to make sure that you know about that, feel free to email me, and I will also definitely share that information with Mark to put on his Facebook page. Here's my contact information. I try to be as responsive as possible. And if for some reason you reach out to me and I do not respond in a quick manner, please send it again. I try to get back to you within 48 hours. And now I will open it up. Danny, are there any questions?
Yes, ma'am, there are a few.
Okay, well, let's go.
Let's see. David Cantrell asked who to contact about their NOA. You had a slide up, David. If you
put it back up just a second, there you go. I would do the RHCVAX confidence info at nosor.org. They are working through that. And definitely email them today.
Okay. We have somebody else ask, is there a timeline to do the electronic handbook and register for the payment management system? I am out with COVID and I assist the project manager.
Okay. So no, there's not going to be a deadline. They won't say, hey, it's too late, you can't do it. I will say the payment management system can take up to say 7 to 14 days to get all set up. So if you're desperately needing this money, you might want somebody to start that, but otherwise rest up, get better, and then you can get registered. The payment management system is kind of like the SAM and the DUNS and all those registrations where it's kind of a hurry up and wait system. So you could always start the process through the link on your NOA, and then when you have to wait, wait and then finish it up when you feel better. So any of those should be fine, but it's not a rush. It's just a matter of you can't draw down funds until you're set up.
Okay. Rita asked, since they put the amount on the NOA under other, do we have to stick to our exact budget that was submitted?
I don't want to say this would be a HRSA question, but I will say on the HRSA webinar, the way I interpreted it, and if I was a project director on this grant, they really said it was, as long as you follow the program guidelines, it is fine. If you want to reallocate funds and it's more than 25%, so if you got the basic amount and it's more than 25% of your award, and you instead want to really change something, and instead of it going to salary, you're going to put it in equipment now and buy a golf cart for vaccine promotion or something, yes, I would write my grants management specialist and my program official for that. Otherwise, as long as you're not making significant changes, I think you're fine. If you're just, if it's staying in the same category, you definitely do not need to get permission. So if you had it for, you're using supplies, but instead of doing a Facebook campaign, you're going to do an Instagram campaign, that's fine. If it was in personnel and instead of paying the nurse practitioner, you're going to pay a doctor or you're going to pay a front office worker, that's perfectly fine as well.
Okay. Is there a limit of how much you can draw down at a time? Is it recommended to do quarterly? Or are there any basic guidelines from your experience?
Once you're set up, it's relatively easy. So a lot of people do it monthly and some even do it based on their payroll. So you either have to spend the money and ask for it to be reimbursed, or you have to be spending it within 48 hours. Again, we'll get to more of this on Thursday, but however you think is best for your organization, that's fine. Typically, I spent the money and then I request it as a reimbursement mechanism because it's easier that way.
Okay. There were a couple questions that came in as far as regarding the expense section. First one, is there a template on how advertising should be to avoid breaking RHC rules? Billboards, videos, print, etc.
Mark, I mean,
yeah, that sounds like a cost report question a little bit there. Unfortunately, the PRM 900 series has not been updated in years and years and years, and so it's sort of out of date. Where it talks about yellow pages and all this sort of stuff, it doesn't really talk about Facebook and Instagram and all of that sort of stuff. The basic general rule is that if it's for patient education, it's allowable. If you're advertising to try to get more patients in the door, then it's not allowable. So you just sort of have to go by those general guidelines. And
I tell all my clients, make it education, put something on there, vaccines available. That's patient education then, because, if you're educating people about vaccines or if you're educating people about any kind of health topic, but also make sure to put your contact information on there too.
Yeah. Hey, Danny, this is a question from David Cantrell. I want to make sure we take care of my good buddy here. We received notification that we were now set up in SAMS. Thought we were, but we weren't. Anyway, now we are. We still haven't received our NOA. Who do we contact now about the NOA?
Mark, that was the first one I read, and she pulled up.
You read that? Oh.
Yep. And she pulled up the slide.
Okay, gotcha.
Yep. And again, go to NoSOR about that. And I would, as I advised somebody, actually, I had this very call from someone in Alabama, but right before I got on the screen, and I told him, I would screenshot or PDF the proof you're set up in SAM, because again, somehow it may show you're set up, but sometimes what the government is seeing is that you're not set up. So you might want to save that screen and send that to Lynette Dixon at NoSOR as well, so they have that. rhcvaxconfidence.info@nosor.org. So.
And Tammy Norville is online as well, and she said that they're willing to help out and to reach out to that RHCVaxConfidence info at NOSORH.org. I have to learn that. And Shannon Chambers has been doing fantastic as well. And Nathan Baugh, both of them, oh my goodness, the work they have done has been fantastic. So we really appreciate Tammy and Shannon and Nathan and Elizabeth. Oh my goodness, all the work you did to get everybody before that June 23rd deadline. That was a Herculean effort. So we certainly, as a community, we appreciate what you did for us.
And reach out if you need anything, as always. So feel free to contact me. And I look forward to seeing all of you on Thursday to learn more about payment management systems. So.
All right, Elizabeth, thank you. We'll see you Thursday. Thank you, Danny. Thanks to everybody. We'll be signing off now, and we have a recording. So if you want to watch it later, we have it here. Thank you.